Welcome, 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 welcome. Welcome to Ages Vitality. I am Joseph Brown, the CEO and men's intimacy coach for Mibella Wellness Center, and this is
Dr. Mia, your B3 specialist and board certified gynecologist at Mibella Wellness Center.
well, Dr. Mia. Good to see you again.
Good to see you again.
Like I
Since
didn't
we
see
see
you
each other all day.
all day, every day, right? So today we're talking about weight management
Yeah.
and how it works with us in our latter years of life as we have this growth spurt of hormones or lack of, right? And so today we're going to talk a little bit about weight management and what we can be doing as individuals as well as what we can be doing as couples.
Right.
Right. So real quick, Doc, when it comes to weight management, what are some of the things that we need to be focused on? Sorry, let me take a step back. What are some of the things we need to notice in our lives to understand that we need to be under some type of system so we can control our weight? Because we don't do weight loss at Mibella. Let's understand. We do weight management. We don't lose weight and gain weight. That's not what we do. We lose weight and keep it off. So, and we teach people how to do that. So what are some of the things we need to be noticing in our lives? And there's no age here because it happens from the age of 25 to 65, right? As we see in our business. So what are some things we need to notice in our lives that we need to pay attention to
And do.
to understand we need some type of program or some type of system to control our weight?
Well, I would say, first of all, knowing your weight and your BMI. Like, BMI doesn't lie. Everybody says, well, you know, I'm a black woman, so I got big bones.
I
so
totally disagree.
So the BMI does not count for me. Now, I do say that certain people may be healthy and weigh a little bit more, you know, but I still think we have to take BMI into account. So if we know that our body mass index is up, we know we're in the overweight, especially if we're in the obese or morbidly obese category, we should probably be doing some things. You know, I'm not saying you're supposed to be skinny.
Right.
And that's what, you know, a lot of people get on, like, I don't want to be skinny. I'm like, you're not, because I'm never going to be skinny. Right. It would take a lot for me to be skinny. Yeah. You know what I mean? So
and
I think just knowing that it's an issue
and
and
you're going to have a new husband because I don't want you skinny.
Oh, you don't want me skinny?
No, not bad.
I try. I can't ever get there anyway because I like
food
too much. But now you made me lose my thought. What was I saying?
Something great.
Okay, so when we're talking about the weight management part, knowing that you need to lose the weight, but not just to look good, but to feel good and to be healthy. So I think that's what we have to take, you know, that we have to pay attention to. If you think about it, when you go to the doctor's office, the people in your primary care doctor's office, if you look around the room, the people that are coming very frequently, most of them are overweight or obese.
Right.
So,
well, let's go back to this BMI thing, because me and you argue about this BMI, right? Okay. All right. I've been a 220-pound man my whole life.
Right. And you want to argue with me and say that you're normal weight at 220. Now, to you, no, we're not saying it's normal weight. We're going to say that it's a weight that you're comfortable with. But if we look on the BMI scale, at 220, you are still like a BMI of 30.
Let's make something real clear. I am not 220 pounds
No, we know
today.
that. I mean, no, it don't, baby. You look good. You look good.
But no, even at 234, where I am right now, if I do my BMI, it says I'm obese.
Because you obese, baby. That's what the folks say, that you are obese. If I look at mine right now, it says, because I woke up this morning, I was 149.6 and I'm 5'4", so I think that'll call me overweight. So technically I am overweight, so I still should be kind of paying attention to what I'm doing.
Now, is there a black scale?
It is
and
not
a white scale?
There is not, and that's what I keep trying to tell people. But let me tell you what that scale says is that you're putting yourself at increased risk of chronic disease.
Absolutely.
Especially if you're in the obese category, and if you're in the overweight category, you're headed there.
Right.
You know what I mean? So
if you're like 31.
Yeah.
Right. Not 31 years old. Your BMI is 31.
You're
and
obese.
we know my BMI should be around 24 or 25.
Right under 25 is what they say. Now, for you, I would say 27, 28 would be a healthy weight for you.
Right. So if you're at 31 and you're 5'4", to 55.
That's
okay,
like 50.
Male or female.
Right.
Yeah, which would be about 50. Right. About 50. that is morbidly obese.
Right.
Okay. And at that point, you should be experiencing some symptoms.
Right. So some of the symptoms like back pain, knee pain, joint pain. You probably have been recently diagnosed with high blood pressure. Another symptom, shortness of breath. So it takes a lot more effort.
Probably diabetical too.
Probably a little diabetical going on. So all of those things. So the problem with being overweight and the problem with not just staying with how you feel, but more on that BMI is because it tells you what your risks are for being sick and for developing chronic disease and therefore causing, the chance of you having an early death because of your weight.
Okay. So now we get back to the weight management situation, right?
Also when you're overweight, your libido does decrease.
100%.
If you're diabetic.
I know for me it does.
Yeah, your sensitivity, and your enjoyment of sex decreases.
The blood flow.
Decreases because you can't put as much blood flow. So it affects so many different things that, affect the stuff that we really enjoy.
And I know for me, if I hit 255, my libido is down. No matter how much hormones or my pellets, anything, my libido still is down. So one of my drives, selfishly, to make sure I keep my weight down is to make sure my libido stays up.
Right.
So I'm trying to do 2 days.
Okay, let's go.
So I'm trying to keep my libido up, because
and your energy,
and my energy too.
Your weight is good.
The blood flow is good.
Yeah, and you exercising, so you got more energy. You eat healthy. You know what I mean?
So, as you're saying, the weight management, and you start noticing symptoms, and then your libido's down, and now you have, may have some chronic disease or on the cusp of having a chronic disease, right? So that's one of the reasons to really focus on your weight management. Right. And again, we do not practice weight loss. We practice weight management. So when it comes to that, what are some of the things you as Dr. Mia will be looking at as somebody coming into our office and asking about this or experiencing these symptoms and not even thinking about their weight? Because here's the truth. A lot of people's not concerned about their weight.
Right.
When they're feeling bad.
Right.
Most of the time they come in there just to figure out why they're feeling bad.
Right.
But they're not concerned about their weight.
Right.
So what are some things and how would you address that with a client, patient, or
right. So, well, first of all, I think that to maintain a healthy weight, especially during this growth spurt time or midlife time, I think that in order for you to be a healthy weight, you got to have a healthy lifestyle. Like, there's no other way to do it. So that's why it's so important to focus on when you're eating, how you're eating, what you're choosing to eat, getting your exercise in, controlling your stress. Like, so many people forget about the stress part of weight.
Right.
If you're not sleeping, you're stressed. You can't lose weight. If you're stressed out all the time, your cortisol levels are high, so it's easier to gain weight. When your mood is off, you emotionally eat, so it's easier to gain weight.
Right.
So just thinking about how all of those things impact your weight, which impact your health.
But so no matter what type of program you on,
right,
if you don't change your lifestyle,
it's not gonna work.
It's not gonna
You can go take all the shots, and I have all the shots. I can write all the prescriptions, but the people who come and they lose weight and they keep it off, and it's just like me. I'm an example of that because I started weight management because I was struggling with weight.
Right, absolutely.
So I gained 60 pounds after Marley. It was hard for me to lose it. I got frustrated, and I realized that what I had been telling my patients was just way off. It doesn't work, especially during this growth spurt time.
The diet.
It's not just the diet. There's so many other things.
Right.
So I definitely can sympathize with it being difficult to lose weight, which is why I got into it. But what I do know is after you're 35, decreasing your calories and exercising may not get your weight off.
And this is something we've been at for 25 years.
Right.
Because when we first met,
we started working.
I've
always been on a diet. That's what I tell people. I've been on a diet
years.
since I was in college. I never had to worry about my weight until the freshman 15. And that was the first time I gained weight. And ever since that time, I was on a diet for most of my life. Now I'm on a lifestyle, so I changed it up. But I was always on a diet because I was always gaining and losing. But it was because of what I was eating, how I was eating. And then that's what I was getting back to, not managing the stress in my life, not having my therapist, not having my me time, not having my time to go exercise, making exercise a priority, like all the things.
Right,
you know?
right. And as an entrepreneur, you gotta have a therapist.
You gotta, as a black person in America or anybody walking in America, you
better
need a
have you a therapist.
That's
Absolutely,
right.
absolutely. All right, so back to the individual coming into the office, not concerned about the weight, even though their BMI is 46. They're not concerned about the weight, and they're coming in dealing with symptoms. So how we address that?
Well, we do a consult. You know what I mean? I figure out exactly what's going on. I like to get blood work because a lot of people are pre-diabetic and diabetic, and they don't even realize it. And the importance of that is when you're insulin resistant, it's really hard to lose weight.
Right, right.
So, those people who may have a hemoglobin A1C, which normal is 5.6 or less, but their hemoglobin A1C may be 5.5, completely normal. But
right there.
But but they're insulin resistant. So it's difficult to lose weight.
Yes.
So I like to get the lab work, make sure that they're healthy, their thyroid levels. Thyroid plays a huge role in weight. So when your thyroid levels are low, it's easy to gain weight. You tend to be more depressed. You tend to be cold. You tend to be tired. So you don't exercise much. So I like to get the labs out the way. Then I like to get a history of how they're eating. Because most people just eat wrong. Most people don't eat breakfast. And they say, I do eat breakfast. No, you don't eat breakfast if you don't eat it within the first hour of waking up or working out.
Because it's a break fast.
Yeah, because you got to break the fast.
While you sleeping, you're fasting.
But I would say probably 80% of the people that come to me, Bella, to start a weight management program, they do not eat breakfast within the first hour of waking up. And as soon as we start that, and then instead of eating 1 or 2 big old meals a day, eating frequent small meals so you get to the point where you really can't overeat, that makes a huge difference too. So even if they don't completely cut their calories down immediately, just eating breakfast in the first hour, eating every 2 to 3 hours, and getting that water in, people are going to initially lose weight with doing that alone.
Right. But that's a lifestyle.
That's a lifestyle.
That's a lifestyle. That's a lifestyle. Okay, we're good. We're good. So we're talking about weight management today on ageless vitality. And we're talking about the importance of recognizing your symptoms and addressing the symptoms, going to the doctor, because that's what we've been talking about, going to the doctor, addressing the symptoms, and then doing something about it, which is really what we teach is a lifestyle, not a program to lose weight and gain 15 after you lost 10. Okay, so that being said, so what would you do for the men, though?
The men are my easiest patients.
No, you don't say.
They are the easiest patients, especially for weight management. For weight management, because let me tell you, they don't want to talk a lot.
No.
They're not going to be emotional about it. They're like, I'm here. Usually they come in because it's a specific thing that's happened that they need to lose weight. A lot of times it's their blood pressure's going up and they're afraid to get on blood pressure medicine because they don't want it to mess with their sexual function.
Right.
A lot of times it has something to do with something totally different. Right. But they come in and they come in with a goal.
It's like a man going to a mall.
Right.
We go in the mall.
You got to
we get what we want, and we walk out the mall.
So it's easy for men. They just need to know what to do. Somebody just needs to tell them what to do, and they do
Education.
it. So when I tell them, eat your breakfast within the first hour, don't eat until you're full, do frequent small meals, you know what I mean? Drink your water. They go and do exactly that. So it's the same for men and women. And I think the other thing that we all forget about or don't realize is that hormone balance makes a huge difference. So as women go into menopause, they may be doing all the things right and they just gain 15 pounds, not doing anything different. Still eating the same, exercising, same with perimenopause. I was doing everything right. I got my eating and stuff down. But then when I hit perimenopause, not realizing it, my weight started to come back on, even though I was still exercising and doing all those things. So it's not just lifestyle. Right. It's also that health and that balance component, making sure you have enough hormones. The testosterone just plays a huge role in weight management. So I think that's important. I think figuring out a lifestyle that works for you is important. So we don't exercise together because I like to exercise at 5 a.m. That's where we're 5. Well, I have to get up at 5:48 to do my 6 o'clock workout.
Right.
So, but you don't like to do it that way. So finding a life.
We just can't work out together though, Mia. Let's keep it honest.
Well, that's because you don't like me to tell you how to not hurt yourself.
Yeah. And I've been working out way longer than you. So no, we argue. So no, we can't work out together. No.
Yeah. So everybody can't do it the same way. So you got to figure out what works for you.
What's your system?
So what works for me is paying a trainer. Shout out to my trainer, Peggy Keebler. I pay to make sure that I get up in the morning 4 days a week, 30 minutes on Zoom, and I work out. So
and you're paying for accountability.
And I pay for accountability.
Yeah, absolutely.
And I pay for